Biomed Nexus. Daily updates, your essential biotech, medtech, and pharma recap. No noise, just what matters. TLDR Revolution Medicines, RVMD, surged 41% on Monday to an all-time high of $136.30 on 14.1 million shares, traded 5.5x average volume, following the Phase 3 daraxonrasib data in pancreatic cancer. The company simultaneously launched a $750 million follow-on equity offering to fund potential commercialization and its expanding RAS-on pipeline. Revolution plans to file a new drug application with the FDA under a Commissioner's National Priority Voucher, CNPV. Full data will be presented at the 2026 ASCO annual meeting. Late-breaking data on daraxonrasib plus chemotherapy in first-line PDASD will be presented at AACR on April 21. Oppenheimer raised its price target to $165. Leerink Partners raised to $147. Analysts are projecting 2B to 4 BIs in peak annual sales for daraxonrasib in pancreatic cancer alone. Foundayo, or Forglipron, enters week 2 of commercial availability. Novo Nordisk's oral Wegovy has a roughly 3-month head start. Executive takeaway Revolution Medicines moved fast. Within hours of reporting the most significant pancreatic cancer data in years, the company launched a $700 million equity offering and disclosed plans to file an NDA under the same Commissioner's National Priority Voucher program that got Foundayo approved in 50 days. That is a company acting like it knows the data will hold up. The market agreed. RVMD gained 41% in a single session, with 14.1 million shares changing hands, signaling institutional buying at scale. Oppenheimer raised its target to $165 and Leerink to $147. Consensus expectations before the readout were for median OS around 10 to 11 months. Daraxonrasib delivered 13.2 months, a significant beat. The next catalyst is April 21st at AACR, where Revolution will present late-breaking data on daraxonrasib plus chemotherapy in first-line metastatic PDAC. If the combination data is strong, it would open the larger first-line market and push peak sales estimates further above the 2B to 4B range analysts are modeling for second-line alone. Read Full Analysis, What to Watch, AACR, April 25th. Revolution Medicines will present late-breaking data on daraxonrasib plus chemotherapy in first-line metastatic PDAC, along with 9 total presentations spanning the RAS-on pipeline, Phase 1-2 pancreatic data, Phase 3 NSCLC trial design, next-gen RAS-on compounds. CNPV filing timeline. Revolution intends to submit an NDA under the Commissioner's National Priority Voucher program. If accepted, review could be significantly accelerated, potentially mirroring the 50-day Foundayo timeline. $750 million equity offering. Pricing. The offering needs to price. Given the 41% single-day move, watch for dilution impact and whether institutional demand absorbs the supply. Foundayo versus oral Wegovy. Lilly's oral GLP-1 is in week 2 of commercial availability. Novo has roughly a 3-month head start with oral Wegovy. Early prescription volume data will shape the competitive narrative. Revolution M&A speculation. With a significantly elevated market cap and validated Phase 3 data, Revolution becomes simultaneously more attractive and more expensive as an acquisition target. BMS has an existing collaboration. Top story, Revolution Medicines capitalizes on landmark data with $750 million raise and CNPV filing plan, RVMD. What happened? Following Monday's 41% stock surge on the Phase 3 Resolute 302 results, Revolution Medicines moved to capitalize on the moment with 2 key announcements. The company launched an approximately $740 follow-on common stock offering to fund potential commercialization of daraxonrasib and its expanding late-stage RAS-on pipeline. Separately, Revolution disclosed it plans to submit an NDA to the FDA under the Commissioner's National Priority Voucher program, the same pathway that enabled Foundayo's 50-day approval. Full detailed results will be presented at the 2026 ASCO annual meeting. The market reaction, RVMD closed at 136.30, up 41.35%, 39.87, on volume of 14.1 million shares, 5.5x the 30-day average of 2.6 million. The stock hit an all-time high of 136.80 intraday. Over the past year, RVMD has traded in a range of $34 to $136. Oppenheimer raised its price target to $165, outperform. Leerink Partners raised to $147, outperform. Jefferies maintained a buy with a $140 target. The pipeline. Context. Revolution has 9 presentations scheduled at the 2026 AACR annual meeting, including a late-breaking presentation on April 21st covering daraxonrasib plus chemotherapy in first-line metastatic PDAC. The company also has 4 registrational studies underway across pancreatic cancer and non-small cell lung cancer. Resolute 302, 2L-PDAC positive. Resolute 303, 1L-PDAC enrolling. Resolute 305, zoldonrasib, 1L-PDAC, and programs in NSCLC. The Resolute 309 doublet trial, daraxonrasib plus zoldonrasib, is planned for H2 2026. Executive impact. The 750 meters raise is strategically sound. Revolution entered 2026 with approximately $2 billion in cash and short-term investments, but the company is burning roughly $365 million annually on R&D alone. Commercialization infrastructure for a pancreatic cancer launch will require significant additional investment in sales, medical affairs, and market access. The CNPV filing path is notable because it signals Revolution expects to receive the same priority treatment that Foundayo received. If the FDA grants a CNPV, the review timeline could be dramatically compressed. Analysts are projecting $2 to $4 buys in peak annual sales for daraxonrasib in pancreatic cancer alone, not including NSCLC or other RAS-driven tumors. The week ahead now, Foundayo or Forglipron, week 2 of commercial availability. April 20 AACR late-breaking data, daraxonrasib plus chemo in first-line PDAC, RVMD, April 2026, Heart Rhythm 2026 conference. April 2026, Novo Nordisk Wegovy, HD US launch continues. Late April, Pharma Partnering US Summit, San Diego. May 6, Revolution Medicines. Q1 earnings May 12 to 14, Fierce Biotech Week, Boston. May 2026, Replimune, Type A meeting with FDA expected. Red, Full Analysis Biomed Nexus Pro, Institutional Intelligence Briefing. Today's Pro Brief, CNPV filing. Playbook. What Revolution's NDA filing under the Commissioner's National Priority Voucher means for timeline and how it compares to Foundayo's path, peak sales math, Y2B to 4B for daraxonrasib in pancreatic cancer may be conservative, and what the NSCLC expansion could add. AACR preview, what to expect from the April 21st late-breaking presentation and the other 8 Revolution data sets. Updated Catalyst calendar, upgrade to Pro. Today, read, full article. Selective 2026 sponsorship placements are available. Reply directly to discuss a partnership or submit an inquiry here.